disorders are umbrella terms for a wide variety of learning problems. Kids with learning disabilities aren't lazy or dumb. In fact, most are just as smart as everyone else. Their brains are simply wired differently, and this affects how they receive and process information. Simply put, children and adults with learning disabilities see, hear, and understand things differently. This can lead to trouble with learning new information and skills and putting them to use. The most common types of learning disabilities involve problems with reading, writing, math, reasoning, and listening. Children with learning disabilities can succeed. It can be tough to face the possibility that your child has a learning disorder. You may wonder what it could mean for your child's future, or worry about how your kid will make it through school. But most kids with learning disabilities are just as smart as everyone else. They just need to be taught in ways that are tailored to their unique learning styles. By learning more about learning disabilities in general and your child's learning difficulties in particular, you can help pave the way for success at school and beyond.
One of the major mistakes the family and sometimes the therapist have in dealing with learning difficulties or learning specific disorders, that they are mixing between learning difficulties, learning specific disorders, or the subnormality and sometimes the pervasive developmental disorders. For that reason, the early diagnosis and the very specific diagnosis and looking for the comorbidity between these disorders is very important, and looking for the primary and the secondary disorders and what are the main symptoms here. What we are having is very important. The coloring of the society and the culture of these disorders and the way of the management in the society and the culture usually started before going to the therapist. Not only in the Arabic societies, but even the Westernized societies. The reports coming and discussing these issues, they are investigating, looking for the spiritual causes. One of the issues happening in many countries, especially in the developing countries. For that reason, I have mentioned that many times in many programs and many episodes of this program, that understanding the difference between normal and abnormal child is very important. The issue, what the normal improvement or normal development per age, per year, how the normal development is very important to understand as a father or as a mother. And if you have any question or any query, please consult your psychiatrist.
Learning disorders or learning disabilities is some sort also of neurodevelopmental disorders. Learning disabilities, it's included dyslexia. It's mean the patient or the child cannot able to read in a fluency way. And dysgraphia. Dysgraphia, it's mean a problem or impairment in dictation and writing skills. You can find also that learning disability may include dyscalculia. Dyscalculia, it means that the patient cannot able to make the arithmetical process in a short time and make it right. Another thing you can find in learning disabilities is that learning disabilities related to memory impairment, that the patient cannot or the child cannot able to recall the science or the information he has just taken from a while.
Specific learning disorder. It is an important disorder because it may affect about or up to 15% of children in school age, which diagnosed in this age specifically.
disabilities look very different from one child to another. One child may struggle with reading and spelling, while another loves books but can't understand math. Still another child may have difficulty understanding what others are saying or communicating out loud. Because of the wide variations, there is no single symptom or profile that you can look to as proof of a problem. However, some warning signs are more common than others at different ages. Preschool signs and symptoms: problem pronouncing words, trouble finding the right word, difficulty rhyming, trouble learning the alphabet, numbers, colors, shapes, days of the week, difficulty following directions or learning routines, trouble learning the connection between letters and sounds, unable to blend sounds to make words, confuses basic words when reading, consistently misspells words and makes frequent reading errors, trouble learning basic math concepts, difficulty with reading comprehension or math skills, trouble with open-ended test questions and word problems, dislikes reading and writing, avoid reading aloud, spells the same word differently in a single document.
Diagnostic criteria. Diagnostic criteria related to specific learning disorders including the following factors. One of them, impairment in academic function, deterioration at attention and concentration. We can find that there is impairment also in reading, writing, spelling, dictation, poor arithmetical process in patients who are suffering from learning disability. We can find also that specific learning disorders may include some sort of deterioration in reading, writing, and some sort also in low self-esteem, because patient or child who is suffering from specific learning disorders, in comparison with other children, can find himself that he cannot communicate with them, and he found himself he can not able to enhance himself or increase himself in the academic level.
experts aren't exactly sure what causes learning disabilities. Some possibilities include heredity. Often, learning disabilities run in the family, so it's not uncommon to find that people with learning disabilities have parents or other relatives with similar difficulties. Problems during pregnancy and birth. Learning disabilities may be caused by illness or injury during or before birth. It may also be caused by low birth weight, lack of oxygen, drug and alcohol use during pregnancy, and premature or prolonged labor. Incidents after birth, head injuries, nutritional deprivation, and exposure to toxic substances can contribute to learning disabilities. Learning disabilities are not caused by economic disadvantage, environmental factors, or cultural differences.
Causes mostly genetic, because it may run in families. About 40% of cases have a genetic load of this disorder. Some studies accuse the encoding process and working memory. Also, prenatal and perinatal complications may affect the brain of the child, may be trivial to pass unnoticed and appeared when gain school or have a challenge of study, begin to develop the learning difficulties. Also, cerebral palsy may affect specific learning disorder, may have a great risk for a specific learning disorder, specifically if they have a mild palsy. Also epilepsy and malnutrition, so investigations is very important in this disorder to find the etiology, which may be in some cases be treated and efficiently.
The main comorbidity with learning disabilities is that the patient suffering from poor self-confidence and poor self-esteem, and we can find a lot of patients who suffering from learning disability with mood disturbance. Some of them suffering at the future from depressive episode, and another patient suffering from emotional disorders.
should be cautious about treatments that are promoted as a cure for learning disabilities. While some medical interventions, such as medication, if a child has also been properly diagnosed with a coexisting disorder such as ADHD, can be most helpful. Many treatments are unproven and ineffective. Many of the treatments that we see promoted through advertising are extremely costly and have no independent research showing that they are effective and that the effects are sustained over time. Should parents find a treatment that looks promising, a substantial amount of homework should be done before proceeding. Parents can be quick to act on a promising treatment, wanting to help their child if at all possible, keeping in mind that a learning disability is a lifelong condition that cannot be cured, will help parents to make wise decisions. Ask for contact information from other parents whose children have undergone the treatment program and ask for independent research that shows that the program or treatment achieves the results promised. Then, post messages in some of the online discussion areas and seek feedback from other parents. Ask teachers and other professionals if they know of the treatment and its efficacy.
You have a variety to make a behavior or therapeutic plan with children who are suffering from learning disabilities. How? You can use a context in a main or the original language that the patient or the child suffering from dyslexia in reading it, and started to make a two context. One of them with the patient who suffering from learning disability, and another one with the doctor or the therapist who try to enhance his way to reading. And the same started to read at the same time. The same person started to read at the same time. In this point or in this time, you can record the child reading during the session, and to make a comparison between his previous reading without the therapist and the post-reading by the therapist. You can find a severe and a significant improvement in his way of reading.
For the drug treatment, which usually is combined with behavioral interventions, certain type of occupational reintegration, we may use antidepressants. For example, the selective serotonin reuptake inhibitors are commonly used medications for the treatment of the depression or anxiety or any type of condition that may be prominent in patients or children with learning disorders.
Assess all the learning disabilities by using intelligence subtests and intelligence scales, such as the Stanford Binet 5 editions and the Stanford Binet 4 edition. And we can also make an evaluation for learning disability specific dyscalculia by using Wechsler-Bellevue intelligence scale for children preschool and for children at the age from 5 to 15 years old.